Supreme laryngeal mask is a very good device in using as a replacement for endotracheal tube, especially in laparoscopic surgery. Nowadays, most of the general surgical cases done with the laparoscope, which may require head tilt position up or down. And I found Supreme laryngeal mask is a good device in replacing the endotracheal tube. Obviously, we select the patient to use the Supreme laryngeal mask. A patient who is not having a risk of aspiration or regurgitation, like patients with hiatus hernia, for example, we avoid it. And other obese patients, sometimes we find it difficult to use Supreme, but otherwise we found Supreme giving a very good tight sealing and delivering the minute volume we require, and also the fact that it gives an easy access to orogastric tube insertion is a good credit without using laryngoscope or without using McGill forceps or anything. And at the end of the operation, when we reverse the patient from the muscle relaxant, the patient goes through the recovery with the Supreme laryngeal mask, which can be taken out in recovery easily. So I found it quite useful device in replacing endotracheal tube. Usually the procedure not more than 90 minutes. So 1 hour to 90 minutes is quite acceptable using the Supreme laryngeal mask. The anatomical position of the cuff is actually giving a good seal around the larynx and laryngeal inlet, and that is the most important upgrade for the second generation of the laryngeal mask. And also the fact that you can easily position orogastric tube is another credit. I cannot recall any kind of extra morbidity. Many of them had some sore throat, but I can say it's one of the credit to the Supreme that the rate of sore throat is much less than endotracheal intubation. Supreme laryngeal mask is a very good tool to use in replacing endotracheal intubation in ventilated patient for a procedure between 1 hour and 1.5 hours. Number one, it avoids the traumatic effect of laryngoscopy and intubation of the patient. It also gave a good seal around the cuff of the Supreme, gives a better seal than the conventional laryngeal mask. It also can easily get an access to the orogastric tube without, again, traumatizing the patient with McGill forceps or with the conventional insertion of the nasogastric tube or orogastric tube.